Welcome everyone. Hello. This is Hallie Cloud and welcome to Health Reform Beyond the Basics. Before we begin, we'll have a couple intro things. Beyond the Basics is a project of the Center on Budget and Policy Priorities. It is designed to provide training and resources to facilitate enrollment in the health insurance marketplace and in Medicaid. We provide these resources for healthcare assisters, state and local officials, and others who help people get and keep their health coverage. The Center on Budget and Policy Priorities is a nonprofit policy organization, and it is not a part of the U.S. Department of Health and Human Services. This webinar series is also not intended for press purposes. As always, we are recording today's webinar and we'll circulate both the recording and a copy of the slides, as well as any resources that are talked about in the webinar. We will circulate them next week, and we'll also post them to our Beyond the Basics website at healthreformbeyondthebasics.org. Everything will be posted to that website probably later today, maybe tomorrow. So if you would like to check that sooner, you are welcome to. For now, all participants are muted and in listen-only mode. You'll remain that way for the entirety of the webinar. So if you would like to ask a question, please click on the Q&A icon in the control panel at the bottom of your webinar screen and just type your question into the box. We're going to monitor that throughout the webinar, so you can type in a question whenever you'd like, and then we'll pause a couple of times for Q&A. We're definitely not going to be able to answer every question that is asked, but we will have a record of your questions, and we use them for guides, for future reference guides, and also for future presentations. If you have a question that doesn't get answered and you really would like it to, you can individually email us at beyondthebasics@cbpk.org, and we can individually answer your question. So for today's webinar, part 7 in our 9-part series for Open Enrollment 10, we're going to provide an in-depth review of the HealthCare.gov renewal process for 2023 coverage, including redetermination of premium tax credit eligibility and plan enrollment. Today's presenter is Jenny Sullivan, Director of Health Coverage Access here at the Center on Budget. And with that, I'm going to turn it over to Jenny to begin. Thanks, everyone.
Great. Thank you so much, Hallie. It's great to be with you all again this afternoon. And the one other additional piece of logistical information I will share is that our webinars do not count as continuing education credit for any certification that you may require as part of your assister or agent and broker duties. So just keep that in mind. We are thrilled you're here, but we don't offer those kinds of credits. So today we're going to talk about redeterminations and re-enrollment. And we'll focus specifically on the HealthCare.gov process in states that use the HealthCare.gov platform. But as with many of our other webinars, the broad concepts apply in all states. So even if you are in a state with a state-based marketplace, the renewal process is going to look pretty similar to what you'll hear about today. So 3 R's today: renewal, redetermination, and re-enrollment. You may have heard these words used interchangeably in the past, but we are going to try and be a little bit more precise and unpack the differences. Renewal is kind of a broad term that refers to the whole process. But when we talk about redetermination, that's really redetermination of eligibility for financial help. So for advanced premium tax credits, or APTCs, as they may refer to them at times, and cost sharing reductions. And then the re-enrollment part of the equation is once we've determined, yes, you can get marketplace coverage, and that might be marketplace coverage with financial help, what plan are you going to have next year? And how do we decide what plan you get assigned to or choose? So we'll also walk through the cascade of notices people receive, both from the marketplace and from insurance plans as part of the renewal process, because that's really what it feels like from the consumer perspective. They're getting lots and lots of notices this time of year. So first, let's talk about the key dates. You likely already have your calendars marked, but just to be clear, The 10th annual open enrollment period for marketplace coverage does begin on November 1st, and it runs through January 15th in HealthCare.gov states. So people who are currently enrolled can begin updating their information and selecting a plan for 2023 as soon as open enrollment begins. And then they have until December 15th to do this. We call it active re-enrollment, in order to have coverage that starts January 1st of next year, and hopefully to have continuous coverage so they don't have a gap between when one plan stops and another one starts. On December 16th, automatic re-enrollment occurs for January 1st coverage. We will emphasize this, I will emphasize this today many times, but it's important to remember that even though people have until January 15th to choose a plan, automatic re-enrollment will place people in a plan effective January 1st. So of course, any re-enrollments or enrollments for that matter that happen after December 15th, they'll have a February 1st effective date, unless somebody has a special enrollment period, in which case they can have sort of a quicker turnaround time from the moment they choose a plan to the time that that plan takes effect. So here are the open enrollment dates for state-based marketplaces, just to have those handy for folks. Every state, with the exception of Idaho, begins November 1st, and most state-based marketplaces have chosen to mimic HealthCare.gov and extend open enrollment through mid-January. A handful give people more time through late January to enroll in 2023 coverage. But remember, these dates can change from one year to the next, and in extenuating circumstances, a marketplace may decide to change them and make extensions by a day, a week, or sometimes even more than that, depending on what's going on in the state. We have seen this happen in the cases of both technical challenges and natural disasters. And it's always important to keep an eye on those dates and to help the folks that you are serving understand when there have been changes in the dates. It's hard to keep track of from year to year for folks, and that's really no surprise. Lots of details for folks to keep track of. So now let's get more into why it is so important to encourage active re-enrollment. This is by far the most important takeaway out of everything we're going to talk about today. If some of the things in the weeds trip you up or you don't quite catch them, you can go back and listen to the recording. But the number one thing that I really hope everyone comes away with today is how critically important it is for people to actively re-enroll, or do an active renewal, I should say. So it's always been important, but it is even more important this year because last year was such a record-breaking number for marketplace enrollment. We had 14.5 million people sign up for marketplace coverage during last year's open enrollment period. And now that the American Rescue Plan's more generous premium tax credits have been extended, many more people, because they were in place last year, many more people chose to enroll. And fortunately, that additional help will continue in 2023. So we want to make sure that people stay covered. Out of the people that enrolled last year, more than 1 in 5, about 3.1 million, were new to marketplace coverage, which means they have never been through the annual renewal process. They might not even know there is an annual renewal process. So looking at last year's renewals as a gauge, we saw that about 60% of the enrollees actively renewed, which is pretty good, but that still means that about 40% of people were automatically redetermined. And while it's really important to make sure that people don't lose coverage altogether if they don't get around to re-enrolling or updating their information, it should really be a backstop, and the preferred route is that everybody take a look at their options and actively renew every year. So why is it so important for people to come back and renew? Even if they like their plan, even if they don't think there have been any changes to their situation. Because when an enrollee comes back to actively renew their coverage, they go through the application and update all of their information. And then all of that information is crosswalked with the new plans and new premiums for 2023 coverage so that people can get the most accurate PTC determination possible. We want them to get all of the assistance they qualify for, but minimize the risk that they'll take too much assistance and owe some of it back next year at tax time. We also want them to get the most accurate cost sharing reduction determination. We don't want people to miss out on that if they're eligible, because you can't get those back. That's not something you can reconcile. You either are in a plan with CSRs or you're not. And there might be people who are, as they go through this process, realize that they are newly eligible for Medicaid or CHIP, which the application will also account for, and which we absolutely want to make sure people are navigating to that coverage, since it will likely cost them even less than a marketplace plan or provide benefits that they couldn't get through the marketplace. So that's why to update. As far as what needs to be updated, the most significant thing is income. A household's projected income for 2023 could be really different from their projected income for 2022 when they applied last year, and different from the income information that's available in the Federal Hub. Remember, the Federal Hub holds the latest tax filing data for the household. So what they have right now, the most recent information they have, is from when people filed their 2021 taxes earlier this year. We also want to make sure to account for changes in family size. Maybe somebody moved out, or maybe there were new people added to the household, and changes in offers of employer-sponsored coverage. People are obligated to report these changes, but they often fail to do that if they're auto re-enrolled. They think that it doesn't matter, they've answered the question once, they don't think about it ever again, but they are really supposed to be updating the application if there have been any changes to what's available to them from an employer. I'm going to anticipate questions and say that there is still a chance that we will see the Treasury Department issue a final rule that would eliminate the so-called family glitch. There was a proposed rule issued earlier this year, and what they would do is change the rules for how they determine if an offer of employer-sponsored coverage is affordable for the employee's spouse and dependents, in a way that would allow more of those people potentially to get access to premium tax credits. Now, if this rule is finalized before open enrollment begins, then we expect that it will apply to 2023 coverage. I promise that Beyond the Basics will send you information just as soon as we know that that final rule has been released. And we are all waiting with bated breath to see when that will happen. But I promise that we will keep you updated, and we may even look into doing additional webinars to make sure that folks feel really comfortable with any changes that roll down at the last minute. We're also going to spend a lot of time talking about it next week on our webinar next Thursday. But if you have other questions, of course, always feel free to reach out. So in addition to changes in the enrollee situation, there are, of course, always new health plans available every year. And those can have different premiums and out-of-pocket costs. There can be changes to provider networks, and there can be overall changes in plan structure. The person's individual or family health needs may also change from year to year. They might need a new prescription that they didn't need in the past, or they may need to see a different specialist, or maybe they no longer have needs that they had last year, and they might want to consider a plan with lower premiums and higher cost sharing. No matter what the situation is, the best option is, of course, to come back to the marketplace and shop the new options and actively re-enroll. It's also really important that people cancel any unwanted plans. Maybe a person no longer wants marketplace coverage, or they become eligible for Medicaid or CHIP, or even Medicare. It's really important to cancel these unwanted marketplace plans so that the person isn't on the hook for premium payments or repaying premium tax credits that they receive in 2023 when they really didn't intend to have marketplace coverage at all in 2023. If they just let the autopilot take control, then they could be on the hook for premiums that they don't want and coverage they don't want. So what does the process look like when someone returns to the marketplace to actively renew? Well, it's a two-step process, as I sort of foreshadowed at the outset. First, the marketplace is going to redetermine eligibility for financial help, and then the re-enrollment process of choosing a new plan for the year happens. So in redeterminations, we're looking at whether somebody is still eligible for premium tax credits and potentially cost sharing reductions, or whether their circumstances have changed, and that might mean that they lose access to financial help, or that they become eligible for Medicaid or CHIP, or maybe they learn that they now have a qualified offer of employer-sponsored coverage. When we do the redetermination in an active renewal process, then all the information that we use, that the marketplace uses to make that redetermination, is coming from the enrollee. The passive renewal, meaning the person doesn't engage at all and just sort of lets the system run its course, then HealthCare.gov will update the enrollee's information based on the information they have about the person and the household in the federal data hub. After the eligibility redetermination has taken place, if the person is still eligible for a marketplace plan and potentially for financial help, then they need to re-enroll in a plan for 2023. Now, if someone is actively renewing, then it looks a lot like the initial process of choosing the plan when they first enroll. Their financial help information is updated, and then as an assister, you can help them compare plans and prices and choose from all the plans available on the marketplace in their service area. Somebody lets autopilot take control and is doing passive renewal, then HealthCare.gov uses its own hierarchy to reassign the enrollee to a plan for 2023. So now we are going to get a little bit more into the weeds of how that passive renewal process works, starting with how HealthCare.gov conducts that redetermination. So first, the marketplace gets information from the IRS about enrollees' income from the most recent year that they have data available from. So in most cases, if the enrollee filed taxes earlier this year, then that's going to be the most recent data. That'll be their 2021 income. From there, the system is going to sort people into two groups: people eligible to re-enroll with financial help and people who can re-enroll but without financial help. So the with financial help folks are on the top there with the blue lines. Without financial help is in the bottom with the red lines. So people in the first group who are eligible for financial help can choose to do nothing, and their APTC or cost sharing reductions will be automatically renewed using updated poverty guidelines, the new benchmark premium in their area, and their most recent income information. We'll walk through examples of this in a moment. Or these people can choose to provide updated information to the marketplace and have their financial help redetermined based on that information. And this can happen at any time during the open enrollment period, including after December 16th, when people have been automatically re-enrolled in another plan. They still have until the deadline, January 15th, to update their information, get a new APTC amount, and shop for a plan. That coverage wouldn't start until February 1st. People who are redetermined as not eligible for financial help will also be auto-enrolled, but without financial help. Now, this may or may not be accurate. Just because the system has made some assumptions about what they're eligible for, it doesn't mean that it reflects that person's reality, because they haven't come back to tell the marketplace what's going on in their life. So it's really important that people understand the value of coming back and updating their information. And as an assister, it's important for you, even if you're working with somebody after December 16th, you need to go in and see what has happened to their account, because they'll still be on the hook for the first month's premium unless they either cancel the plan before December 31st or update their information. But you're never precluded from coming back and actively enrolling. That door is always open to folks who want to do it, no matter what information is available about the person and sort of which one of these red or blue lines might apply to them at the outset of the process. So now I'm going to go over the notices that an enrollee will receive. They'll get these potentially in the mail and definitely in their HealthCare.gov electronic account. Depends on their account settings, whether they're getting things in the mail as well. But the big one is the Marketplace Open Enrollment Notice, which sometimes is abbreviated as MOEN. This is what the marketplace sends to enrollees about a month before the open enrollment period begins. So people are probably getting these now. You can see the screenshot on the slide here, and you can download these notices, these sample notices, at the link in the upper right-hand corner of the slide if you want to really dig into the language and see the kinds of things that consumers are receiving. So the Marketplace Open Enrollment Notice includes information about open enrollment dates, includes a description of the redetermination and re-enrollment process, and it includes a description of how eligibility for financial help will be redetermined if the person doesn't actively update their information. And it also emphasizes the importance of updating the application and actively renewing coverage for all the reasons that we have already talked about. And there are different versions of this notice for different people. So for example, there's a notice for people who will be re-enrolled without financial help, because those folks could be on the hook for their full January premiums. So that notice warns them that this could happen and encourages them to update their application before December 15th. So now we're going to talk more about the different groups of people getting different versions of the Marketplace open enrollment notice. So the biggest group by far is the standard group. These are people who have granted the Marketplace permission to pull their recent tax data. They have updated their application at least once in the past couple of years, and they were enrolled in coverage with financial help this year. They also can't fall into either of the two special groups of folks who can't be redetermined, which we'll talk about in a moment. Now there used to be another group called the income-based outreach group who would get a different notice. These are people who had a higher income and looked like they could potentially be at risk for losing financial help. And so there was sort of special messaging to make sure that those folks updated their information and didn't lose financial help if they were still eligible. But we no longer have that group, or we don't for now, because as you'll remember, people with incomes above 100% of poverty can now get premium tax credits if they meet other eligibility criteria. And so there really is no need for that sharp cliff between who has tax credits and who doesn't. So these people, if their income is above 400%, we're not differentiating for purposes of the open enrollment notice. They are just getting the plain old standard notice. And if they don't take any action, these are people who will be automatically re-enrolled with a redetermined premium tax credit. So there are some other groups as well, and these are the people I mentioned who are not eligible for auto redetermination of their tax credit. People in these groups have to return to HealthCare.gov to update their information if they want to get an eligibility determination for financial help for 2023. Now, this includes people in the opt-out group. These are people who did not check the box in the application that authorized the Marketplace to pull their tax data to update their income and household size. We've also got people in the repeat passive group. These are folks who have been auto-renewed for the past couple of years for 2021 and 2022 coverage, and there's no IRS information on income for recent years. So it's time to come back. You can only automatically renew and passively renew so many years in a row before you have to come back and start verifying information again, or at least updating your application. You've also got people who just aren't receiving APTCs and CSRs. Remember, there are some people in the Marketplace who aren't getting financial help, and they can't get automatically redetermined because they've never been determined in the first place. They would need to return to HealthCare.gov to request an initial determination if they thought that they might qualify. And really, this is not a bad idea, because since tax credits are available to folks with income above 400%, there very well could be some people who are buying full cost Marketplace coverage who might actually qualify for some advanced financial help. So people in any of these three groups will be re-enrolled without financial help, unless they return to the Marketplace and update their information, in which case you would have an accurate determination of exactly what's going on with them right now. So finally, in normal years, there was another group of people who could not be automatically renewed for financial help. These are people who failed to reconcile their premium tax credits at tax time, the so-called failure to reconcile group. And they would get a notice saying that their eligibility for financial help can't be redetermined until they attest that they filed a return and reconciled last year's tax credit. So in normal years, these folks wouldn't be automatically redetermined, but this year, in the past couple of years, the Marketplace has chosen not to act on the information about the failure to reconcile group. Because of the pandemic, there have been significant delays at the IRS in processing tax returns. And so people who have this failure to reconcile status will be allowed to be redetermined without going through the sort of attestation and recheck process about their previous year's taxes and tax credit reconciliation. But I just want to be clear, because this is easy to misunderstand, this is not an exception to the requirement to file taxes and reconcile APTCs. All this is the marketplace giving people a little extra grace and saying, you can still renew. It's still important that you reconcile your tax credits, and that's something that will happen between you and the IRS. But in the meantime, we're not going to say that you can't have coverage for the coming year. So if someone is renewed without financial help, we all know that it's pretty unlikely that they will be able to afford the premium, particularly if they were getting help before and then they inadvertently lose that help for the coming year. That's why premium tax credits are such a centerpiece of marketplace enrollment. If someone is in this situation and being renewed without financial help, and that makes their coverage unaffordable for them, it's really important that they terminate that coverage before the end of the year, so before December 31st, which again is why I say that that window between December 16th and the end of the year, it's very busy for lots of other reasons in this country. But if you see folks that are renewing during those critical weeks, make sure that they understand what they may be on the hook for January. And if they don't want it, that is their golden period to cancel that coverage without having to be on the hook for the premium. If they don't terminate the plan, then they owe the January premium. And if the enrollee doesn't pay their premiums, then they go into a grace period, but they have to catch up on all the premiums they owe by the end of the third month of coverage in order to stay enrolled. So this would be like March 31st or so for people auto re-enrolled for January coverage. If they don't get caught up on the premiums that they owe, then their coverage is terminated back to the last day of the first month of coverage. So this would be January 31st in this case. But even if this happens, they're still on the hook for the full cost of any healthcare services that they received during the second and third months of coverage, so like in February and March, and they're still liable for the full premium for January coverage. This can feel really awful if a consumer doesn't know that it's coming or doesn't know what to expect. People really do have to take action to avoid this circumstance. Enrollees might assume that they would only be re-enrolled in coverage for 2023 if they actively chose to, but that is just not how the marketplace rules work. And so it is yet another reason why active renewal can help save a lot of tears and grief later. One other thing, sort of a side note, but while we're talking about unpaid premiums, I just wanted to note that there has been a change this year that says that insurance companies can't refuse to enroll somebody in a plan in the future simply because they were terminated in a previous year due to unpaid premiums. Now, this is new. Previously, insurers could deny future enrollment in a plan due to non-payment of premiums. There are some pretty complicated interactions between grace periods and automatic re-enrollment. We have a fact sheet that should be updated on our website very soon that walks through examples of that. We're not going to go through that today, but I think that's another set of rules that can be good reading. Sit down with a cup of tea before open enrollment starts and just reacquaint yourself with some of those rules about what happens if somebody is automatically re-enrolled in the same plan versus a different plan, and the implications for what they owe if they have unpaid premiums. So there are also people who are not only ineligible to continue to get financial help, they're also ineligible to have their marketplace plan renewed at all. No financial help at all, just people who can't be in the marketplace at all because the marketplace doesn't have enough information to continue saying that they're eligible. And this is usually people in a coverage group where at least one person in the coverage group has become eligible for Medicare. If one person in the group becomes eligible for Medicare Part A or is found to be enrolled in Medicare Part B, then the marketplace plan is terminated at the end of the year for everyone in the group, not just the person who became Medicare eligible. So you can imagine in many cases, there could be a spouse in particular who is in the household but has not become Medicare eligible yet. So the people in the coverage group who are not becoming eligible for or enrolling in Medicare, they will not be automatically re-enrolled. They have to come back to the marketplace in order to keep marketplace coverage and financial help. They may also be getting premium tax credits, but if they want to keep those, it's essential that they come back and actively re-enroll. People in this situation also qualify for a special enrollment period if they don't re-enroll before the end of the open enrollment period. So there is a bit of a backstop for these folks. These people will also get notices from both the issuer of the marketplace plan as well as the marketplace about the situation. So they should be hearing the message, but nonetheless important for you to know how this affects them. Okay, now is when the fun starts. That's what I always say when we get to the math part of the presentation. This is when you want to sharpen your pencil or get out your calculator if you feel so inclined, because we're going to get into the math of how APTCs and CSRs are redetermined. And I keep including CSRs just to be clear, because cost sharing reductions are a critical part of the financial help that people receive. But remember, those are based just on what income group you're in, and they travel along with the APTC for the lowest income folks. So in order to redetermine the amount of someone's APTC, we need 3 pieces of information. We need the relevant poverty guidelines for the year. We need the benchmark premium for the geographic area where the person is enrolling for that year. And we need the most recent income information that's available for the person. So for income, there are several potential sources of usable income. And for those, the marketplace uses a hierarchy in determining what to rely on. So first, they'll start with 2022 projected income, if that's available. That's the income that somebody said that they expected to earn in 2022 when they either initially enrolled during open enrollment last year, or maybe they had a special enrollment period and got enrolled or updated their income during the 2022 coverage year. If we don't have a 2022 income projection, maybe because the person was auto redetermined last year, then the marketplace will look to 2021 tax data from when the person filed their taxes earlier this year. Neither of these are available, then the marketplace will go back to the household's 2021 projected income that they provided when they enrolled. But that's getting back a ways. This could be from as early as October 2020. And a lot has taken place between October 2020 and 3 months from now, when coverage is going to be in full swing for 2023. So just keep in mind that a lot can happen in these long periods of time. So let's look at a couple of these examples for how redeterminations work. First, we've got Nadia. She updated her income either last year during open enrollment or some point during 2022. And if she doesn't take any additional action before December 15th, then the marketplace will take her most recent income as a percentage of poverty and use the equivalent dollar amount for 2023, which is, again, 2023 coverage. We're using the 2022 federal poverty guidelines. So her income was 150% of poverty in 2022, which was $19,320. 2022 coverage is based on 2021 poverty guidelines. So the marketplace is going to redetermine her APTC eligibility based on that dollar amount adjusted for the 2022 poverty guidelines. That makes it just a little bit higher at $20,385. Now, there's a hidden piece of information that I don't have on this slide, because in most cases, these are not calculations that you're going to be making by hand. But in order to adjust income from one year to the next, or potentially to 2 years into the future, if the income information is a couple years old, we're going to look at the rate of change, or the growth rate in the federal poverty level for the family size in question. And those percentages are available on our fact sheet. We have an updated FAQ about the renewal process, and there is a handy table in there if you really got curious and wanted to get your pencil out and crank some of these math problems. That's where you're going to find that adjustment percentage that gets us from a past year's income amount to the 2023 amount that will be used for auto redetermination. So the second example is Bryony. Bryony hasn't updated her income in a long time. She's got a longer lag between now and the last time she had relevant income information provided. She enrolled in 2021 and auto renewed for 2022. So since the marketplace doesn't have 2022 income on file, they'll instead use, oh yes.
I'm so sorry. I think the slides aren't advancing.
Oh, I am still on slide 19.
You're still on slide 19? Perfect. Never mind. Keep going.
No
Sorry.
problem. Thank you. I always want to know.
Everyone.
Technical glitch. I appreciate that.
Yeah.
So because the marketplace doesn't have 2022 income information for Bryony, they are going to go and use her 2021 tax data. And when she enrolled in 2021, her income was equal to 265% of poverty. So we're going to adjust her 2021 income for the 2022 poverty guidelines, which gives us an income amount of $36,000, $36,014. And again, this is not just a matter of taking the dollar amount and dividing it by the new poverty line for the relevant year. It's really a growth factor that you're applying to this, and that's why the math may not be entirely intuitive when you look at the slide. Now I've advanced. Now we're on to slide 20, and we're going to get into even more complicated examples. So, and before I do that, again, just a reminder, the marketplace will do this math for you. I'm just going through these examples so that you understand what's going on in the background. That will help you both explain it to the people that you're helping, and it'll give your radar, sort of fine tune your radar in case you need to raise red flags because something doesn't look right. So let's look at how HealthCare.gov would treat Nadia's renewal if she had no income updates during the year. At open enrollment last year, her projected income was at 150% of poverty. And with the enhanced premium tax credits, she's actually eligible for a zero premium plan. So the benchmark plan is $4,000 in her area, which means that is also her total premium tax credit. So this year, when it's time to redetermine, HealthCare.gov will hold her income as a percentage of the federal poverty level constant, and they would adjust her income to be 150% of poverty based on the 2022 poverty guidelines, so $20,385. Now, the benchmark premium has increased a little bit to $4,200, but she remains eligible for a zero premium plan, so her tax credit also increases to $4,200. Now let's look at how this would play out if Nadia did update her income at some point during the year, which is really the more likely case for most folks. Things change, income can change throughout the year. Her 2022 projected income was $19,320, but she updated it to $25,245 a few months ago when she got a new job. She was a dutiful marketplace enrollee, and when she had a change in circumstances, she went to the marketplace within 30 days of that change and reported it. It's great. So this makes her new income equal to 196% of poverty. So she's responsible for a minimum contribution of, or she has an expected contribution rather, of 1.84% of her income, or about $465 a year. So we subtract $465 from the benchmark premium of $4,000, and we get $3,535, or about $295 a month for her premium tax credit in 2022. Hang on one second, I'm going to take a sip of water. So this fall, HealthCare.gov adjusts her income based on the growth rate of the federal poverty level between the 2021 and the 2022 poverty guidelines. So they use $26,636 as her income amount to calculate her PTC. Her required contribution is still 184% of her, 1.84% of her income, which is $490. We subtract that from the new benchmark premium of $4,200, and we get her new premium tax credit of $3,710, or about $309 a month. So even though her income went up a bit, because the cost of benchmark plans also went up a bit, she's actually getting a higher tax credit by a few dollars this year than compared to the year before. Okay, one more scenario with her. This time, let's say she was passively renewed last year in 2022. So during open enrollment in 2021, she enrolled with a projected 2021 income of $19,140, or 150% of poverty. Then last year, HealthCare.gov adjusted her income for the 2021 poverty thresholds, which came out to $19,320. She also filed her taxes this past spring, and her 2021 income was $23,000, or 180% of poverty. So it was higher than she projected, which means she may have a repayment obligation on some of the PTCs she received when she files. But anyway, we don't have a projected income for her for 2022. The most recent income information we have is the $23,000 from her 2021 tax return. So the question is, what is her redetermined income for 2023? Well, again, HealthCare.gov has to use her 2021 tax data to come up with her income. Adjusting it to the 2022 poverty guidelines, that makes it $24,495. Now we can use that to calculate her premium tax credit. So the required contribution for somebody with income at 180% of poverty is 1.21% of income, or $296 a year. We subtract that from the new benchmark premium, and her new premium tax credit is $3,904, or about $325 a month. Just to cap off some of that difficult math, that's just to show you the mechanics of what's going on behind the scenes, but in few to no circumstances will you be having to do any of this math yourself. Unless something seems really strange, then it's good to know how things are churning along in the background. So with that, let me pause before we get into the last section here and just ask Hallie, are there any questions that we should address now?
Yeah, there's a couple questions, and then we'll do more questions at the end too. But I did want to do a couple clarifying questions. So if someone makes a change to their 2022 application in October, August, sometime before open enrollment starts, but then they do not return to the marketplace to enroll for 2023. Do those changes that they made earlier in the year, are those reflected in auto enrollment for 2023?
That's a great question. No, that's a great question. Yes, they are. The marketplace is always going to look for the most recent information about the person's situation. And if they updated their information during the year in 2022, then that's the information that will be used for re-enrollment or for redetermination, excuse me.
Awesome. Thank you. One more clarifying question. If someone is not receiving premium tax credits, will they or will they not be auto-renewed?
They will be auto-renewed as long as there is not somebody in the coverage group who couldn't be auto-renewed because they're eligible for Medicare. That's the big exception. But they would be in this case, we would call it auto-enrolled, and we'll talk about that in a moment. They'll be assigned to either the same plan or another plan, depending on the dynamics of their service area, but they would be renewed for the new year.
Perfect. And then one more quick question, and then we'll again do more at the end. If someone is auto re-enrolled, and actually we're going to talk about this a little bit too, so this might lead into the next section, but if someone is auto re-enrolled and then chooses a different plan between December 16th and the 31st, when does that newly selected plan take effect? Would it be January 1st or February 1st?
So in most cases, that would be February 1st. And they can actually choose the plan anytime between December 16th and January 15th. But again, we want to make sure that in the meantime, if they don't want the plan that they were auto assigned for January, that they cancel it. Otherwise, we want to make sure that they pay their first month premium so that they don't have a gap in coverage, so they still have health insurance coverage in the month of January. There was another piece of it that I lost, but basically they need to they need to have paid the premium and canceled any other plans. And then their plan that they select between the 16th and the 15th of January, 16th of December and 15th of January would start February 1. Oh, I know the other part of it. And that's that in a few cases, people might be eligible for a special enrollment period because the plan that they had before was discontinued, in which case they have 60 days from when that plan was discontinued, typically December 31st. And that plan would be effective the first of the month after they make a plan selection for a new plan. So that it gives them basically more leeway and more rapidly effectuates coverage in the new plan.
Perfect. And we'll answer more questions at the very end. And I'll also put a little link to our special enrollment chart, because it gets really confusing on when plan dates start, because some rules it starts, the standard rule is it starts the first of the month. Anyways, we can go into it later. But yeah.
Yes. And a lot of them have, in the past year, they have changed so that for most special enrollment periods, the 15th of the month rule is no longer in effect in HealthCare.gov. So as long as you choose a plan, it becomes effective the first of the following month, even if you choose the day before. You know, if you choose on March 31st, you'd still have coverage effective April 1st for many special enrollment periods, most on HealthCare.gov. Okay, let's chug through the rest of this. I think we've covered the hardest part personally, but which is redetermination. But once we know how much financial help someone is going to get, we also want to look at how the marketplace selects a plan for someone if they don't come back to the marketplace during open enrollment. So the most straightforward thing would, of course, be to continue someone's enrollment in the same plan that they were in the prior year. And a lot of times that's possible. And so that's exactly what the marketplace does. But marketplaces are by definition dynamic. That's the whole idea. Plans come and go, they compete. Hopefully prices are competitive. And so plans change from year to year. And in some cases, the exact same plan that someone had in 2022 might not be available in 2023. So in this case, there is also a hierarchy for the marketplace determining what plan someone would be assigned to. If the same plan's not available, they will re-enroll someone in a new plan offered by the same issuer that is as similar as possible to their 2022 plan if they can. If this is not possible, for example, because the issuer pulled out of that market, then the person will be auto-enrolled into a new plan with a different issuer that's as similar as possible to their 2022 plan. And this all happens when auto re-enrollment takes place December 16th to get people into a plan, again, that's effective January 1st. People still have until the end of open enrollment to pick a different plan if they're not satisfied with the plan that they're matched to via auto enrollment. And this is what we were just talking about in the Q&A a little bit. But this is one of the good things about that slightly longer open enrollment period. If open enrollment had ended in mid-December, as it did in many years past, then people who were auto re-enrolled wouldn't have that opportunity to make a switch if they didn't like where they were assigned. So this is what it will look like for people who are auto enrolled into the same plan. They will get notices from the insurer that list their premiums, the benefits, any cost sharing changes for the coming year. And the premium on that notice will be based on the household's redetermined APTC, if possible, or the amount of APTC that they got for 2022, if not. And it's really just an estimate, right? The insurer is not in charge of determining how much financial help somebody gets, but that's included in this notice so people can understand, get a ballpark sense of what they're going to be paying in the coming year. And notices this year, CMS provided a little bit of extra flexibility to plans because we weren't sure if the enhanced financial help was going to be continued by Congress. And so some notices may not contain any information or just will say what you got last year with no comments about what people would get in 2023 because Congress didn't make a decision about that until August, which was cutting it pretty close for some issuers populating their notices. So the notice will also mention any changes to the plan. The person can then choose to come back to the marketplace anytime before January 15th or until January 15th to change plans if they want. And then their new plan would start February 1st. People also have, as I've said many times, until December 31st to cancel coverage without incurring a January premium for the new plan. Okay. So, and people can check the status of what they've been reassigned to almost right away on December 16th. So they should be able to log into their HealthCare.gov account, see what's happened to their enrollment fate for 2023 and the amount of financial help they'll get, and then act quickly if something there doesn't sit right with them. Okay, so now what if the exact same plan somebody had in 2022 isn't available? Well, we know the marketplace is going to automatically re-enroll them in a similar plan from the same issuer if they can. So the person is going to get notices from that issuer with information about their financial health, their benefits, the cost sharing for the new plan, just like they would have gotten if they'd been able to keep the exact same plan. But they will also get information about qualifying for a special enrollment period since their previous plan was discontinued. And again, that special enrollment period matters even during open enrollment because it gives people longer time to make a plan selection decision, and then it turns around the effective date of that coverage more quickly than if it's just a regular open enrollment plan change. So finally, what if someone's 2022 plan was offered by an issuer that has left the marketplace altogether for next year? So HealthCare.gov in that case would automatically re-enroll them in a similar plan, but one that's offered by a different insurance company. People in this situation will get lots of notices. They get one from their 2022 issuer telling them that their plan has been discontinued and that they're eligible for a special enrollment period. They get a notice from HealthCare.gov stating that they're going to match the person with a different plan offered by a different insurance company. They also get a notice from the new insurance company, the cross-issuer notice that provides details about the plan and how to pay the first month's premium. Now, because this person is a new customer of a new issuer, they have to make that January premium payment, the binder payment, by January 1st to effectuate their coverage. So lots of things have to happen in late December to make sure that people are where they need to be for the new year. Now, a little bit more about the special enrollment period when an issuer has discontinued someone's previous plan. The special enrollment period is based on loss of qualifying coverage, and people have 60 days before or after the discontinuation date to choose a new plan. If they choose before, the effective date of the new plan is the first day after loss of coverage. So if the person makes a plan selection before December 31st, then their new coverage will be effective January 1st, no gap in coverage. They would still have until January 15th to change plans if for some reason they wanted to, but they have that special enrollment period so that the change can take effect right away without having to wait for a February 1st effective date. If they choose for the special enrollment period coverage to take effect after, then the effective date is the first of the month following their plan selection. So if they make their plan selection on January 31st, they could still get coverage that starts February 1st. Okay. Coming close to the end here, we have one more example. Victor, who is enrolled in a 2022 marketplace plan, but his plan is being discontinued for 2023. So he gets all the notices from his current plan from HealthCare.gov, from the issuer of the new plan that he's matched to, but it's a busy year. It's a busier time of year for him, and he's not really doing anything about these notices, but he finally gets around to checking his HealthCare.gov account on December 20th. I think you all know what happens next. He can see that he's been auto-redetermined with financial help of $300 a month for 2023, but he actually expects he's going to make more money in 2023. He has a new job. So at that moment, he updates his application and he is now eligible for less APTC. But he also looks at the new plan that he's been matched with, and which will show up at the top of his plan options during the plan selection process. So it will be very obvious and easy to compare with his other options. And he likes this plan and decides, yep, I'm going to enroll. Now, because he is a new customer of this issuer, he has to pay the first month's premium by January 1st to effectuate coverage. That is a short clock. He just has about 10 days to get it right. If he misses this premium payment, then the grace period doesn't apply like it would for a missed premium payment for a plan that somebody already has effectuated coverage in. Now, Victor does have the 60-day special enrollment period because of the loss of qualifying coverage when his previous plan was discontinued. So if he chooses not to enroll in the plan that he was matched to, he still has 60 days from the date he lost coverage to select a plan and enroll. We can see here that he's covered in December, and then his plan ends December 31st. So unless he chooses a different plan or pays the first month's premium for the plan he's matched to before December 31st, he could have a gap in coverage in January. A special enrollment period will last for 60 days after the loss of coverage, so he could wait as late as February or potentially very early March to choose a new plan, but that plan wouldn't start until the first of the month following the date of plan selection. All right, more notices. You can see how easy it could be for people to get confused. They're going to be getting a lot of information, and it's your job to help them understand that all. So we talked before about the Marketplace Open Enrollment Notice, the MOEN, that comes before open enrollment begins. But then there's also the eligibility determination notice, shorthand EDN, which everyone gets, that confirms their eligibility determination for the coming year. And this includes the plan name, the plan ID, how much financial help someone gets, as well as the income amount used to make the determination. And if someone doesn't get the EDN, then they are not enrolled. This is a critical notice. There are multiple versions of it. There's a version for people eligible for a marketplace plan and financial help, one for people that are just getting a marketplace plan without financial help, one for households with people eligible for different forms of coverage, and one for people assessed eligible for Medicaid who need to look for a final determination from their state Medicaid agency. And again, you can see samples of all of these notices at the link in the upper right corner of the slide. Importantly, the notice also tells the person their next steps, like choose a silver plan to get CSRs or send in documentation to resolve a data matching issue. The EDN for HealthCare.gov was just revised earlier this year, so you'll see that it should be a little bit easier to determine which action steps apply to which people in the household. Now, if someone has been automatically re-enrolled because they haven't returned to the marketplace, they also get an enrollment confirmation message. This explains what the marketplace did when it auto re-enrolled the person or the household, and includes the eligibility determination, confirmation of the plan name ID, and how much financial help they're getting. This is an important notice. It will explain whether the person was matched to a different issuer, whether they were enrolled without financial assistance or not, or whether they need to submit any additional information to keep coverage. And the screenshots on the right here are from the 2021 notice, but it will be essentially the same for next year. Okay, terminating coverage. We've talked a lot about this, but here is what the button looks like. It is appropriately red, but HealthCare.gov actually gives enrollees multiple ways to terminate their coverage. They just have to do this again by the end of the calendar year so that they are not on the hook for the January premium. It's not intuitive that people get a bill for a January premium because they didn't take action and didn't realize they were being auto-enrolled. And I'll note that this is even true for people who are enrolled in Medicaid. They still need to actively terminate their marketplace plan, or they could be stuck with a January premium. It's not an automatic thing. So making sure that you work with families to cancel coverage they don't want is a really important part of the renewal process. So just to bring it all home, now that we've looked under the hood a bit on the redetermination and re-enrollment process, I'm sure it's pretty clear by now why actively shopping for coverage and updating your information is the best way to go. And it's also important to plant a seed with people who are enrolling with you for the first time so that they understand what they need to do next year. It might be the only time you talk with them before they renew their coverage for 2024. And so that's maybe the most important moment to communicate to them the importance of coming back the following year. When you go over all these details, if you are fortunate enough to have somebody who is with you and actively enrolling, then it's really important, especially because folks may have never been through this process before. Reminding people of the December 15th date for selecting a plan to start January 1st is critical. Reminding them that they only have until January 15th to change plans unless they qualify for a special enrollment period. And then looking out for people who qualify for cost sharing reductions, but maybe choose or are auto-enrolled into a non-silver plan, which can happen. All really important points to hit on when you are helping somebody renew. And of course, cancel any plans they don't want before the end of the year. So with that, we have literally a couple minutes for questions. There's a bunch of links in here, which when you download the slides from our website, these will be active links for you if you want to get into any of the regulations and guidance around all of this, or check out the sample notices. And with that, Hallie, we have time for one or two questions.
Yeah, we'll do just a couple quick ones. So when someone cancels a marketplace plan, is that immediate? So is that immediate essentially?
That is for the end of the year, it would be canceling the plan effective December 31st. If they cancel the plan during the year, then it would have an earlier effective date.
Awesome, thank you. And then you mentioned something that is not written in the slide, so I want to make sure we went over it again about a new rule with people who are terminated for not paying premiums and then want to enroll in a plan with the same insurer. Could you just quickly go over that one more time for everyone?
Yeah, sure. That's a great one. That was in this year's annual payment notice for 2023 coverage. And it just says that insurers can't do this anymore. They can't solely on the basis of saying, you know, you're not a reliable source of somebody who will pay their premiums. We have terminated you in the past, so we're not going to allow you to re-enroll in our products in the future or in this specific product. CSIO has said that that will not be permitted anymore, and that is not sufficient reason to not enroll somebody in a plan. And I say that with with only the slightest bit of caginess, again, because there are some interactions between auto re-enrollment and grace periods that get pretty complicated. And there are cases when an issuer still can not effectuate coverage or discontinue coverage based on unpaid premiums, but that's slightly different than this new rule. And again, that's all laid out in our premiums and grace periods FAQ, which is available on our website now, and an updated version of it is coming very soon.
Yeah, we'll have that up hopefully by tomorrow. I'll put the link in, but note that it is not the updated version yet. That link will go to the updated version as soon as we get that all together, which again should be tomorrow. So putting that in the chat now. And then just one more quick question. You said this earlier, but if someone reports a life change and is found eligible for Medicaid instead of the marketplace, do they need to cancel their marketplace plan, or does the system automatically cancel it for them?
So glad you asked. Always actively cancel. It would be nice if everything cooperated and worked automatically, but that is not a reliable way to avoid owing premiums for coverage that you don't want. So always actively cancel if somebody has become newly eligible for something else.
Awesome. And I think with that, we will bring this to a close. As a reminder, we are recording today's webinar. We will post it to our website at healthreformbeyondthebasics.org, along with the slides and any of the resources we talked about today. We have 2 more upcoming webinars in this sort of core 9-part series for open enrollment. We have one next Thursday that's tying kind of all of these rules together. So it will be a lot of examples and kind of trying to put these things together in sort of real life situations. And then we also are going to have a webinar entirely in Spanish on October 20th on Thursday about helping to assist Spanish speaking clients. So we're very excited about that one too. And please spread the word. You can register for those on our website as well. Here are emails. If your question didn't get answered and you really need an answer, please email us at beyondthebasics@cbpp.org, and we can individually answer your question. You'll find lots of resources. The other parts in this open enrollment series, the 9-part series, are all posted to our Beyond the Basics website. Lots of reference guides, frequently asked questions, all of that. And again, if you need assistance, please email us. We really appreciate you guys all being here, and we hope to see you next week. And with that, I'm going to bring this to a close. So thank you so much, everyone.